I am Dr. Adam, and with the Bright Minds at Beatrice, we'd like to take you on a healthcare and wellness adventure with these two delightful helpers, Fizz and Emmy, and a team of specialists, Dr. Saul, the knowledgeable Dr. Aisha, and the professor with unparalleled medical expertise, Dr. John. We'll help the ill family who always think they're ill deal with the many health problems that come their way and learn a thing or two ourselves as we go along. Now, shall we get down to important matters? Because your health matters.
You know, you really shouldn't be doing that, Bill.
I heard it all before, Doc.
Have you?
What's that?
What you probably haven't heard of before, my friend. You see, Bill, smoking causes about 7 million deaths annually worldwide.
Out of town. So who said that?
The World Health Organization?
Oh.
Not enough to scare you, huh? Well, when we think global, every 1 in 10 deaths is associated with smoking. It's the second leading risk factor for early death and disability worldwide, in both men and women. Actually, the prevalence of smoking being 5 times higher in men than women.
Who's the flying man?
Wonderful! Dr. John, down here.
How's he flying?
Adam, how are you? Oh, it is good to see you, sir. Your meditation energies have quite certainly reached new heights, haven't they?
Oh, you're a smoker. I say, don't you care about your lungs, son? Do you have any idea what happens to them when you smoke? Right. Let me give you a bit of insight. The lungs play an important role in absorbing inhaled oxygen and removing carbon dioxide from your body. You know, breathing. Injury or disease affecting the breathing process can cause several difficulties. Breathing in cigarette smoke can damage the airways, preventing proper airflow in and out of the lungs.
Smoking is a major cause of diseases worldwide. Smoking, even in small amounts, increases the risk of developing several serious illnesses. Illnesses like osteoporosis, skin wrinkles, stomach ulcers, impotence, and pregnancy complications.
Well, yeah. Okay.
Okay.
I think it's pretty clear that Bill needs more convincing, Dr. John.
You can have a stroke.
Say what?
And that's just the top part of your body. Let's talk about the other parts.
What?
Your chance of a heart attack, diabetes, stomach ulcers, bone disease increases.
Okay. Smoking causes a lot of problems everywhere. I don't feel so good.
I am not finished, Bill.
Oh, you're not? Well, please continue then.
It can increase your blood pressure and also weaken your immune system.
Wonderful.
Vision impairments, sores in your mouth, even oral cancer.
Oh my God.
I believe that did the job. And you see, Bill, smoking doesn't just affect you, it affects those around you as well.
That can't be a thing.
Secondhand smoke is a serious health hazard for non-smokers, especially children. In fact, children of smokers are also prone to have more respiratory infections than those of non-smokers.
I can quit any time. It's just a bad habit.
It's not just a bad habit, it's an addiction. Nicotine from smoke is a highly addictive chemical that increases our blood pressure and heart rate. It is absorbed by the blood, allowing it to get to the brain within seconds. Once in the brain, nicotine encourages the release of chemicals in the brain called neurotransmitters, which help regulate mood and behavior.
Just so you know, Bill, one of the neurotransmitters released because of nicotine is called dopamine, which improves mood and feelings of pleasure.
Such effects make nicotine very addictive. So when the levels go down, you begin to crave it again.
Oh yeah, but still, I can quit any time I want. Well, seriously, I just do it to kill time.
That's what every smoker says. But sometimes certain situations or feelings will trigger those cravings. There are actually many associations that trigger a person to start smoking again, such as certain times of the day, such as first thing in the morning, with morning coffee, or during breaks at work. Sometimes people crave smoking after a meal, or drinking alcohol around certain places or friends. Talking on the phone is actually one as well. Let's not forget how mood affects this as well, so people smoke more when they're stressed or feeling low. The most obvious would have to be the sight or smell of another cigarette. And last but not least, when driving the car.
Driving in the car?
Do you enjoy the occasional smoke while driving, Bill?
Oh, it's such a great feeling to drive and smoke. The window down, the wind between my... Wait, that doesn't mean I'm addicted.
We aren't saying you are, but here are some signs that you might be. Like if you have an inability to stop smoking, experiencing withdrawal symptoms when smoking is discontinued, continuing smoking despite health problems, and giving up social or recreational activities to smoke. Let's put it this way. You're spending a lot of money to basically ruin your health.
To be more specific, billions. Smoking is known to directly affect healthcare spending, with an estimated $107.6 billion in indirect costs due to loss of productivity annually in the United States alone. If smokers quit before they develop any symptoms related to smoking illnesses, they can avoid about 70% of the excess healthcare costs. Do you believe it's really worth it?
Well...
Do you even know what's in cigarettes?
Nicotine, right?
Nicotine can be found in cigarettes, but it is also a part of insecticides. You can also find arsenic, which helps preserve wood and rat poison. Ammonia, which can be found in household cleaners. Acetone, which is used in nail polish remover, can also be found in cigarettes. Not to mention butadiene, which is a part of lighter fluid. It doesn't just stop there. Cigarettes also have benzene, and that helps manufacture rubber. Cadmium is an element that helps in the making of batteries. And then there's chromium, which helps make paint. You know the carbon monoxide that's released from your car exhaust? Yes, that's in there too. Chloroform, that's in there too, as well as in solvents for dentistry. Still a few more to go. Naphthalene, which is an ingredient in mothballs. Formaldehyde, which is a strong-smelling gas that is used in making building materials. Polonium, which is a radioactive element. And last but not least, there's tar, the thing they pave the roads with.
All right, you got me. Smoking is very harmful for me and those around me. I hope you're happy now.
There are many ways to help reduce smoking that can help, like nicotine replacement therapy or pharmaceutical intervention.
There you go.
For heavy smokers, however, we would recommend counseling to help you through the process. Thanks for the help, Dr. John. I think it's safe to say Bill is going to think twice before smoking again.
Glad I could help, Adam. Till next time.
And again, let's not forget, smoking causes about 1 in 10 deaths globally. It is the second leading risk factor of early death and disability worldwide. Smoking adversely affects most organs in the body, particularly the heart and lungs. Smoke from cigarettes is known to have more than 5,000 chemicals, many of which are dangerous to our health. Nicotine from smoke is a highly addictive chemical that affects overall behavior negatively. Quitting smoking is one of the most effective ways to improve health and reduce financial stress. Remember, folks, health matters. You can visit the below website to gain more information on health and wellness and access the Health Matters with Dr. Adams' series of videos. If you feel you need further healthcare and wellness information, you may consult with your family doctor.